All right, we've reached 12 noon, so welcome everyone to Friday's COVID situational update regarding the local pandemic situation. Great to have you here with us today on the Friday before a long weekend. Lots to cover, so let's get into it. And as we prepare to enjoy this beautiful part of the world, let's take a moment to respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so with us today, we have our Board of Health Chair, Mayor Andy Mitchell from the Selwyn Township. So please feel free to start us off with some opening remarks today. Andy, go ahead.
Thanks, Brittany. The province announced 3 important initiatives yesterday. First, that the stay-at-home order will remain in place until June 2nd, and that it has maintained all public health and workplace safety measures under the province-wide emergency break. Second, the province has amended the orders to allow for additional outdoor activities. This includes outdoor recreational activities like tennis, skate parks, golf, and other activities. The changes also allow for the fuller operation of marinas and for outdoor social gatherings of up to 5 people. Third, the province announced a 3-stage approach to reopening and the types of activities that will be allowed under each stage. The first stage will begin once 60% of all Ontario adults have received their first dose of vaccine. The second stage will commence a minimum of 21 days after the start of stage 1, and after 20% of adult Ontarians have received 2 doses, and 70% have had 1 dose. And the third stage will commence a minimum of 21 days after stage 2, and after 70 to 80% of all Ontario adults have received 1 dose, and 25% have had 2 doses. Each stage allows for additional activities to take place, first outdoors, and then gradually indoors. The province will also be taking into account other metrics such as case counts, ICU capacity, and hospitalizations. It is important to remember that even though we will be allowed to undertake some additional activities tomorrow, and a limited number of others once stage 1 commences, how we do them must continue to adhere to public health guidelines, including, when not with members of our household, maintain a physical distance of 2 meters. When you cannot maintain a 2-meter distance, wear a mask. Wash your hands frequently, and if you feel ill, stay home and get tested. We've come a long way. The path forward has now been outlined. The fastest way along that pathway is for all of us to get vaccinated. Peterborough Region, we can do this. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, now I will invite Dr. Salvatierra to walk us through the statistics. Go ahead.
Thanks, Brittany. So our active case counts continue to fluctuate daily, and you can see here on this slide it has increased again to 109 active cases from the 103 we reported on Tuesday. The variants of concern continue to be the dominant strain, and that's particularly B117. The number of close contacts we are following has also risen to 374. This number was 285 last Friday, so it's a difference of almost 90. I'll show you on the next slide. This comes from the modeling data that was shared by the province yesterday, and it compares what's been happening in Peterborough with what's happening in other parts of the province. So you can see the health units that have the increasing case incidence rates are on the left, and that's where you can find Peterborough. And then on the right are the health units with decreasing rates. So we're on the right, along with a couple of neighbors, but we are certainly in the minority, along with 7 other health units that are seeing cases go up rather than down. So I really can't emphasize enough that we must not be socializing indoors. We have to maintain that 2 meters distance, as Mayor Mitchell has said, and really wear a mask when we're around anyone outside of our household, whether we're indoors or out. I mean, we have many reasons for why our rates have been going up rather than down. We've had local cases, for example, that have arisen from people boating together. So I do want to advise everyone who may be tempted to take out their motorboat or their canoe this weekend that the provincial regulation that comes into force tonight at midnight prohibits non-household members from sharing a boat or a watercraft for recreational purposes. So we have lots of great water space out there, but we need to use it very wisely. Next slide, please. Here on this graph, you can see how the 3rd wave is still very much in progress here in Peterborough. So far this week, we've reported 38 cases. Next slide, please. The number of active outbreaks has increased again. We're now at 5. 2 of these are in daycares and 2 are in workplaces, and 1 is a congregate living setting. We'll look at our incidence rates, and starting to the right of the slide, you can see, if you follow our line, and we're in purple, that our weekly case incidence rate has increased slightly to 63 cases per 100,000, but that's up from 45 cases per 100,000 from last week. You can also see that we have we're in good company with our neighbors, but you can also see how far Durham's rate has dropped. And so that the difference between Durham and Peterborough is not as dramatic, but it also serves as a reminder that other parts of the province are experiencing potentially greater rates of transmission, and that interregional travel is not encouraged this weekend or any time during the stay-at-home order. We'll look at our wastewater surveillance. So I'll give you a little bit of an orientation. The normalized wastewater results are in green. And these are from the city's water treatment plant. And you can see that it's continuing to detect viral shedding. And so this serves as a very good indicator to us that we do have infected people living within the city. The red line is the active case count for all of us. And we can only hope that those individuals, whether they're cases or high-risk contacts, are self-isolating until they've been cleared by public health. Next slide, please. So on to share some good news. Since last Thursday, we've administered almost 70,000 doses of the COVID-19 vaccines here in Peterborough. That's about 4,000 more than last week. Locally, just over 64,000 of our residents have now received their first dose. And that corresponds, if you look at the pie chart, that corresponds to almost 53% of the eligible population. So now that the Premier has included vaccination rates as part of the rationale for moving through the next 3 steps of reopening, I'm sure we'll be keeping a closer look at both our first dose and second dose achievements. If you look at the bar graph just on the left, it shows you our vaccination levels by groups. Nice to see so many of our over 60s now immunized with their first dose. And now that we have 18 and over eligible, we look forward to seeing all of those bars increase week by week. I want to, though, acknowledge that I am aware that people are frustrated, that they are waiting for appointments to open up, and I do apologize. We have been mandated recently by the province to run family clinics in June, in the middle of June, for youth aged 12 to 17 and their parents. And so that might result in a little longer wait for others. So again, I ask you for your patience and can just advise that you keep checking. We do post appointments that can be booked at regular intervals whenever we are able to do so. So there's lots to cover today. First of all, this morning, the province did announce
My apologies, Rosanna. I've accidentally muted you, so I just have to figure out how to unmute you, and we'll start that again.
I've just unmuted myself.
My apologies. I meant to spotlight you, and I hit mute. So I'm sorry.
Okay.
If you could start again, I'm so sorry.
Okay, I'll start again. Maybe I'll say it even better second time around.
Apologies, everyone. Thank you.
So I just was sharing with everyone that we've had an announcement this morning that people who received their first dose of the AstraZeneca vaccine between the dates of March 10th and 19th will be eligible to receive a second dose next week, which puts the interval at 10 weeks. So definitely there will be an informed consent that is required, but choosing to go ahead with a second dose of AstraZeneca at the 10-week interval is safe, and it does provide strong protection against COVID-19. So if you are one of those people here in Peterborough who received your AstraZeneca vaccine from your primary care provider between those dates, and you would like to get your second dose next week before May 31st, I will ask you to call your provider next week. Not today, please, but next week, and let them know. We will have some AstraZeneca vaccines available here next week. It'll be first come, first serve, and we will be making them available to our primary care providers for that purpose. For everyone else who received AstraZeneca, there will be another announcement about your options for a second dose. But that'll be in the next week or so. We are expecting recommendations from NACI to guide this, and that should happen before the end of the month. Moving on, yesterday the Premier announced a 3-step roadmap that Mayor Mitchell has shared with you. So just a reminder that we still remain in a stay-at-home order until June 2nd. And with the one exception that there will be some outdoor amenities opening as of midnight tonight that will allow, will support exercise outdoors. And so as far as what this might mean for you, I've prepared some of my tips for how we can get to a COVID-free safety plan for our community. I think the first piece of advice is to get immunized as soon as you can and to be patient as we bring more appointments for you. Certainly, if you haven't downloaded the COVID Alert app yet on your phone, it's a great tool to have in your toolkit so that you will get notification if someone, another user tests positive. I am asking that we not forget to perform the self-screen at least once a day, and that if you have any symptoms, even if they're mild, to stay home, not to go to work, not to socialize. If you share your home with others, that would mean putting on a mask and self-isolating, and making an appointment as soon as possible, either at the Northwest or at the assessment center to be tested. And again, important that you continue to self-isolate after testing until you get that result. If you are essential workers here in Peterborough, important that you protect yourselves, that you use protection equipment properly. And for most workers, that does mean a surgical or procedural mask and eye protection. And I'm asking that you not let your guard down when you go on breaks, that you go outside if you can, and that you keep that 2 meters distance from your colleagues at work as well. Again, I think we want to emphasize that it's important that we avoid socialization indoors. The weather is much better and we need to go outside. So please take it outside. There's emerging evidence just published today by Public Health Ontario that COVID-19 transmission does occur by both droplets and aerosols. And aerosols can remain suspended in indoor air long enough to infect others. So being outdoors and having good ventilation are associated with lowered risk. It is with a long weekend for some, not all of us. It is a great opportunity to be outdoors and to exercise. So I hope we will all take care of our physical and mental well-being by exercising. And if you can't maintain that 2 meters of distance with people outside of your household, please remember to wear a mask. If you're exercising vigorously, riding a bicycle, please increase that distance and leave more space between you. I think it's a good idea that if you are going to be exercising outdoors, potentially with people who are not in your household, that you do plan on how you're going to do that safely. It's much easier to follow those rules when everyone is clear and in agreement. When you're outdoors this weekend, please avoid crowds and covered areas where ventilation is compromised. And remember, again, only household members can vote together. Avoid areas where loud music makes it necessary to project your voice and your droplets. Eating and drinking are risky behaviors. Please reduce the risk by maintaining your distance and not sharing food, beverages, or containers with people outside of your household. And finally, if you need to drive somewhere to exercise, let's say you're going to play golf or play some tennis, please don't carpool. But if you have to, wear masks and keep the windows open. And again, remember that we should not be traveling outside of our area this weekend. So following these guidelines is critical. June 2nd falls 2 weeks after this long weekend. And if we want to relax the restrictions and do some other things like enjoy outdoor patios, we really, really need to prevent the transmission this weekend. What we've learned so far is that it's the combination of measures that is the most effective way. And in general, that really means avoiding the 3 C's: crowded spaces, covered or closed spaces, and close contacts. So no single intervention is going to be perfect, but layers of public health measures will provide that optimal protection. So I would like to reiterate what it means to self-isolate. When you go for a COVID test, it means self-isolating until you get your results. The cases that we've had recently related to boating happened when someone who went for testing went boating instead of self-isolating, and that led to COVID-19 being spread to others. One of those people took it into a workplace and has now spread it to colleagues. So remember, if you are a high-risk contact, even if you test negative, you must continue and you must finish your period of self-isolation as directed by your friendly public health nurse or staff person. I hope I've made it abundantly clear about as far as what we need to do to have a safe and healthy long weekend. And as our Board of Health Chair has said, Peterborough, we can do this. So thanks very much.
Thank you very much, Dr. Salvatierra. Okay, definitely lots to cover. So let's now hear from our elected officials. And I see MP Mary Monsef is with us today. If you've got some remarks, we'd love to spotlight you. And I promise I won't mute you inadvertently. So please go ahead, MP Monsef.
Thank you, Brittany. You couldn't hear me because I was muted, but I was like, nobody mutes Dr. Salvatierra. Anyway, Brittany, I think you're incredible. And Dr. Salvatierra and Chair Mitchell, I want to thank you for supporting Brittany to represent Peterborough Public Health at our regular local leaders coordination call. Having Brittany and her expertise and her thoughtfulness at that table is not only a breath of fresh air for all of us, but she's also incredibly helpful with providing us information as the guidance and the safety measures change. So Brittany, we know it's more work for you at the end of what I'm sure are really long days, but you bring a lot to that table, and you've heard at every single meeting, all the elected leaders, business leaders, and social profit sector leaders on the call, as well as post-secondary leaders, appreciate you, your expertise, and your professionalism. And we salute everybody at Peterborough Public Health and those on the front lines of the fight against COVID as we go into another long weekend, which we all usually look forward to, but over the past 14 months, every long weekend has come with anxiety for decision makers and for leaders, particularly for healthcare workers and essential workers. I'll focus the rest of my remarks on vaccines and on borders. Across the country, hospitals, pharmacies, healthcare workers are working around the clock to care for sick Canadians and their families and to roll out vaccines. Thanks to their hard work, some 20 million doses have been administered to Canadians, with millions more waiting to be administered and millions more on the way each week. Brittany shared with us last night that we're at 64,200 folks here in Peterborough having received, or in our region, having received their first dose, and that 52% is a testament to the hard work of everyone involved in this health ecosystem and to our community members for stepping up and rolling up their sleeves and doing their part to put the pandemic behind us. It's because of all that hard work and the confidence of Canadians that Canada remains #1 among all G20 countries in having administered daily doses per capita. This week, the Government of Canada has already distributed some 2 million doses of the Pfizer vaccine and 530,000 doses of AstraZeneca to provinces and territories. 1.4 million Pfizer doses are still being distributed, and that should be completed by the end of day today. Yesterday, 1.1 million doses of Moderna arrived. Distribution to the province is ongoing and should be complete by tomorrow. In total, 5 million COVID-19 vaccine doses will be distributed this week. What does that mean for Ontario? It means 8.9 million doses have been administered, with about 900,000 more arriving throughout today and tomorrow as we complete the delivery of this week's Pfizer and Moderna shipments. Going forward, Canada will be receiving 2 million doses at least each week throughout June and July. With just our scheduled Pfizer shipments alone, Canada will receive 40 million doses by Canada Day weekend, which is only 6 weeks or so away. That's more than enough for every Canadian to get their first shot and to get started on their second shot. This week, Health Canada also approved a change in storage requirements for Pfizer vaccine. This change allows the vaccine to be stored at normal refrigeration for up to 31 days instead of just 5. This will make the vaccine much more easier to store and to distribute to smaller clinics in rural and remote communities and in places like pharmacies and doctors' offices. Greater portability of the Pfizer vaccine is good for all of us. On borders, this week it was announced that the US border will remain closed as it has since March for at least another month. Today, the Government of Canada also announced that the ban on flights from India and Pakistan has been extended for at least another 30 days until June 21st. All non-essential travel to Canada remains banned. International citizens attempting to enter Canada for non-essential reasons will be refused entry, and Canadians re-entering the country are still subject to some of the strictest testing and quarantine requirements in the world. Finally, let me just reiterate what many have already said. It's a long weekend, but now is not the time to travel. Not to get in a car and travel 90 minutes away, 45 minutes away. Stay close to home. Enjoy the great outdoors that this incredible community of ours has to offer. If we get this right, our next long weekend, the Canada Day weekend, will be so much better. And I join Dr. Salvatierra and Mayor Mitchell in believing deeply that Peterborough, we can do this. Back to you, Brittany.
Thank you so much, Miriam, and great to hear the good news about the vaccine supply making its way into the country. Okay, we have some of our municipal guests with us today, some of our elected officials. We have Mayor Therrien and Warden Jones, and let's hear from Mayor Therrien if you have some comments. Please go ahead.
Thank you very much, Brittany, and thanks to Dr. Salvatierra and Chair Mitchell for your words and tips. We've been in this pandemic for over a year now, so we are all familiar with what we need to do to stay safe and healthy and to keep others safe and healthy. And so while we heard from the Premier yesterday that some outdoor amenities are open this weekend, as Dr. Salvatierra said, we need to abide by those guidelines in order to make sure that this weekend doesn't lead to an increase in the cases. And as MP Monsef said, we remain under a stay-at-home order, and we encourage people not to travel. We know despite that, likely there will be some. So I would just encourage everyone to please think about the frontline workers in our communities when you're making decisions this weekend, because they will be working, not enjoying a long weekend like others. So consider the privilege that you have if you are able to relax and find some downtime this weekend. And think about those who don't have that same privilege. And please don't make their jobs harder by flouting the guidelines and the best practices and indeed the law. Try to make their jobs just a little bit less stressful by using your conscience, common courtesy, and as Chair Mitchell says, by using always kindness. So that's all I wanted to say for today. Brittany, thank you very much. Back to you.
Great. Thank you so much, Mayor Terry, and appreciate your support today, and have a great long weekend. So we will now invite Warden Jones to share his remarks as we head into the long weekend. Please go ahead.
Well, thank you, Brittany. And again, thank you for everything you and all the staff there are doing through this. That's the benefit of speaking last. Pretty much everything's been said, and I couldn't say it much better than Diane and Miriam and Andy, and a long weekend coming up. So let's just use our heads and just think, maybe a month from now, 6 weeks from now, we'll be singing a whole different tune, but we just gotta hold on just a little bit longer. And I really did like what Diane said about the first responders. We have our paramedics and all the other first responders out there putting their life on the line, and I really don't think they deserve to be exposed to the virus when they really don't need to be, just because someone wants to go out and have a good time this weekend. So let's hold on. The time is coming faster than we think. Thank you, everyone. Keep up the good work. And hopefully on Tuesday, we'll have a little meeting like this and say, boy, nobody acted really foolish. We're going to get through it. So thanks, everybody. Let's do things for the right reason. Bye-bye, and have a good weekend.
Great. Thank you so much, Warden Jones, for wrapping that up for us. So now we'll move on to our media guests. It's your opportunity to ask questions of Dr. Salvatierra, and we're also fortunate to have some representatives of both the OPP and the Peterborough Police Service. So let's start with Joelle Kovac from the Examiner. If you've got some questions, please go ahead, Joelle.
Brittany and Joelle, I beg your pardon, if I can just have 30 seconds. I've just received some communications from the province that I'd like to share, and that is that as of tomorrow, general visitors will be allowed in long-term care homes and retirement homes to visit their loved ones. And so all of those facilities are being asked today to put into place the procedures that they will need to do the active screening. Rapid testing will not be required for visitors, but they are hoping that these visits can happen outdoors. So if it's been a while since you've seen your loved one who lives in a long-term care home or a retirement home, it sounds like you can go this weekend. So I just wanted to share that really good news.
Oh, that's wonderful news. Thank you so much. Okay, so let's hear from Joelle. If you've got some questions, please go ahead.
I do, and they're for various people on the call. I hope to start with Warden Jones, if you don't mind, because he may need to leave, I don't know. Can you comment, Warden Jones, are there people arriving in the county as we speak and over the last few days to come to their cottages? We're hearing talk about lots of visitors arriving in say the rural grocery stores. There's anecdotal talk of this, but I don't know if we know for sure that we're having a deluge of visitors. Are we?
Yeah, well, anecdotally, that's all the information I would have too, Joelle. I really, unfortunately, think it's going to be about the same situation as we had last year. The peace and quiet will be interrupted by all the cars on the road, but I'd like to give you specific numbers, but I can't. But if I had to bet on it, I'll bet you won't be able to move.
Okay. Oh dear. Okay, and do you have a message for folks who are arriving, or do you feel that this can be a safe weekend still? What do you think about that?
Well, no, personally, yeah, no, people should not be here. They should not be coming from the GTA, and we've had to close off Burley Falls, for example, because of the situation that happened last year. We've had to cut off the fishing along the causeway, etc., because people were abusing it and all those things. So, I'd love to say everyone's learned their lesson and not a thing's going to happen, but I can't say that without any legitimacy. So I just hope and pray that people just use common sense. But I've got no specific information any more than you would have, Joel.
Thank you so very much for answering that question. It's really very much appreciated. Related to that, I had another for Mayor Tarian, if she's on the line still. We're understanding that the anti-lockdown protests are moving over to Beavermead, where there's no, I understand there's no special permissions being offered right now during stay-home orders for use of public parks. Do you have any thoughts or comments about another public park being used for this purpose?
So thanks, Joelle. Yeah, we haven't been issuing any permits or any public use, permissions since the pandemic. So certainly, if these protesters are moving to Beavermead, that's, concerning. That might also be something that Inspector Lyons could speak to. I know that we talked about it at the Police Services Board this week. I've been, pretty vocally outspoken about my feelings about the demonstrators. None of us enjoy this lockdown. Again, we're doing this to try to get out of the situation that we're in. And again, as I said before, considering if you're, I would encourage people to think about those who aren't able to, take a day and go protest, those who are forced to be working, on the front lines and making their jobs harder by continuing to flout the law. But I'm not sure if Inspector Lyons has anything that he wants to add, not to put him on the spot.
Did you have any comment, Inspector Lyons?
Yeah, thank you, Mayor Tarian and yeah, Joelle. It's again, each weekend we have the same resonating theme. People showing up to protest the rules that are in effect, and unfortunately, a lot do not believe that this is actually happening. They think it's a hoax, and I've heard it myself in person that there are people who do not believe that COVID is real, that this is just all a hoax, and that it's very discouraging because trying to educate people that don't believe something's actually happening is very difficult to do. But still, we have to maintain a level of decorum with them. We have to provide safety for them. We are enforcing the ROA, Reopening Ontario Act. Again, not to be heavy-handed, we're trying to deal with the individuals that are in charge of and in bringing people to this gathering place. We'll continue to do that, and we'll continue to enforce the legislations that are currently before us, and continue to try and educate people as to why the spread continues. And it's to do with being in these gatherings without masks and not maintaining that social distance.
Okay, any follow-up charges this week since Tuesday?
I don't believe that there is any follow-up with that. I do know that there are more charges to definitely be laid as from last weekend. I'm just not sure on that, and I can definitely find out for you as to whether or not those charges have been laid.
That's great. Thank you so much. And I have a final question for Dr. Salvatierra. I'm just wondering, Dr. Salvatierra, you made a point of showing us how ours is one of a handful of health units across the province where the cases seem to be increasing, where others are decreasing. Is socialization our best? Is that the most important factor with this continued spread? How do you explain that we continue to have high numbers every day?
Yes, I believe it's socialization, and we do have cases who, reported several visits on Mother's Day, for example, from family members, and then who went on to become cases. And people don't intentionally transmit this infection. Most of the transmission occurs before people even know they're infected or feel ill. So unfortunately, that's happening. And we also have a large number of our cases being infected because one of their household members becomes a case. And the vast majority of our cases are close contacts. So they often are sharing households, accommodation, bathrooms, kitchens with others who are infected, and that's where they've acquired it.
That's really helpful. Thanks so much, and I'll pass it on to my colleagues. Thanks.
Okay, thank you very much, Joelle. Okay, so then to wrap it up from the examiner, Reg Watson, do you have any questions for our speakers today?
No, thanks. Joelle covered everything.
Okay, great. So let's move on to Paul Rellinger. I'm sure you've got some questions for folks. Please go ahead, Paul.
I do. Thank you, Brittany. Hi, Dr. Salvatierra. Mostly clarifications, if I could, but one of the outbreaks on there, the congregate living facility, it's been an outbreak since April 11th, according to that that list, and most of the outbreaks come and go, and they're cleared up relatively quickly. What's the roadblock there? That's going on almost 2 months, well, a month and a half.
Right. Well, the only explanation, Paul, is that we continue to get new cases evolving. So as long as that continues, even if it's just one, it does mean that we can't close the outbreak, and we have to wait at least 14 days after the latest exposure from a case, and if another case happens to arise within that 14 days, then you reset the clock and you start all over again.
Okay, thank you for clarifying that. A couple of questions around the AstraZeneca. I know the group that's being eligible next week, it's only for a certain group that received their AstraZeneca from a certain time. But just to clarify, it's not automatic that the following week that the next group will be, because that's the first thing I thought, like this group that received it then, and then the following week it'll be the next date group, and that's not the case from what I'm hearing, right?
It may or may not be the case. I think what we still are waiting for is the NACI recommendation, and NACI is taking a look at the research that's being done where there's mixing of vaccines, and also reviewing the data for the risk of vaccine-induced thrombocytopenia, VIT, which is the rare but serious risk from the adenovirus vector vaccines. It appears that the risk for second doses is much reduced. But I think in order to be able to give people truly informed consent, they need to know the risks and benefits of all their options. And I think the province just needs a little more time to get that ready and prepared for people. So the only group that's being invited to be immunized next week is that early group, the people who were immunized between March 10th and 19th. And they can phone their primary care providers next week, not today, but next week, to ask for a second dose. And we really don't know how many will want it, because it is only 10 weeks. And certainly since we started with AstraZeneca, there has been some emerging evidence to show that if you wait for 12 weeks, you get the best effect from that dose. However, I do know that some people are eagerly waiting and have other things they need to do in their lives and want that second dose so they can move on. And so there may be people here in Peterborough who will step forward and sign up for a second dose of AstraZeneca next week.
Thank you. And that kind of leads into my next question. For those who received their AstraZeneca shot from their family physician, should they, I'm hearing a couple things. You're suggesting people call, but should they not wait for a call from their physician's office?
Well, there will be some physicians who call. So for example, people who had a first dose of AstraZeneca who have a highest risk health condition where they were guaranteed a shorter interval, some of those people might get called. So for example, someone, a dialysis patient, for example, they may get a call from their family doctor to say, hey, guess what? Your AstraZeneca's in, and this is the week for you to get it. But I think there's only a small number of those people. The rest are going to have to look at their calendars and check out what that date was for their first dose, and then make an informed decision as to whether they want to get their second dose next week or not.
Perfect. Thank you. And I just wanted to, a couple more things around vaccination. The clinics, I just wanted to get an update on how busy you're seeing things at the clinic. Were you pleased with what's been going on Wednesday, Thursday, good numbers, or?
Our clinics are full, and we are vaccinating well over 800 people a day at the Evinrude right now, but the PRHC has also been immunizing this week the highest risk healthcare workers. They had over 4,000 appointments, and they're gone. Every last one of them. So we are seeing lots of interest in vaccination. I wish I had more vaccine. We're getting more, but the reality is that there is still a wait here in Peterborough, and it's not long. It's not a long wait, but I know people find that hard, especially they've been waiting for so long. I just ask that they be patient a little bit longer. We are expecting supply to increase. Once we get into June, it'll increase again. And once we get into June, we're moving our Evinrude from the multi-purpose rooms onto the Leon's ice pad. And that's going to allow us to immunize over 1,200 people a day at that site. So there's lots more availability coming soon.
Great, Dr. Salvatierra. Thank you so much. And I hope you get to enjoy the long weekend. You've earned it as well. So
Thanks.
Great. Thank you so much, Paul. Okay, so we'll move on to Jessica Niznik from Global. But before we do, I just want to acknowledge if there are media guests who have called in or the anonymous caller, please let me know once Jessica's finished if you have any questions. If I don't hear from you, I'll assume that you don't, and we'll wrap it up. So Jessica, if you've got some questions, please go ahead.
I do. Thanks, Brittany. They'll be for Dr. Salvatierra, and then if it's okay, when I'm finished, Katrina has some questions as well.
Okay.
Hi, Dr. Salvatierra.
Hello.
I know you just got this announcement, but I do have some questions about the visitations in long-term care, and you said retirement homes as well?
Yes.
Is it Saturday or Sunday that it starts?
Tomorrow morning, I believe.
Do homes, retirement or long-term care, have the option to turn this down? Is it a provincially, I don't know what to say. The province has said it's okay. Can a home say it isn't?
So I'm just looking at the letter, Jessica, that's been sent. It's to all of the long-term care home licensees from the Associate Deputy Minister, dated today. Now it says these changes come into effect 12:01 a.m. Saturday, May 22nd. And it just says, it essentially states it as, this means that effective tomorrow, general visitors can come. to see their loved ones for an outdoor visit. So it does sound that it's a request being made by the ministry, and hopefully all of the affected facilities are going to work really hard today to put into place what they need to do in order to make it happen tomorrow.
Okay, so they should be following the directive, is what you're saying.
Yes, and I understand. I think there may be exceptions, and I'm not sure if they apply here in Peterborough. If there's a facility that has no outdoor space, they may need to find some outdoor space close to the facility, and it may take them longer. But I don't believe that's an issue for our facilities here in Peterborough.
Okay, thanks. And lastly, for me, a kind of a glum question. Cases have always gone up after the long weekend. They just do. People don't stay home. It's just inevitable. Do you think we could be facing a fourth wave after this, or do you think enough people are immunized that we would be okay? What is your predictions without your crystal ball?
Well, it's really, are people going to stay away from each other? You know, it's distance. And that will, I'm hoping that the good weather is going to be conducive for people to get outdoors and stay outdoors as much as possible. And if they can do that and keep their distance and wear their masks, then we should be able to get through this weekend and not see a rise in our cases. So my fingers are crossed. I hope people will, we've given them all the advice and tips that they need, and the regulations and restrictions will be enforced if they need a little nudge that way. So hopefully we'll do well this weekend.
My fingers are crossed too, but they were crossed every other long weekend. I will pass it to Katrina. Thank you, Dr. Salvatierra.
You're welcome.
Hello, it's Katrina here. I have a couple of questions for Inspector Lyons regarding the long weekend and enforcement. So every long weekend, you know, we typically see, you know, increased, you know, police presence and ride programs and things like that. So when it comes to traffic, what will Peterborough Police be implementing this weekend?
Thanks, Katrina. If I could just start by actually following up with what I had mentioned before regarding tickets from last weekend. I have found out that we actually did issue one ticket in relation to the gathering in front of City Hall, and we did issue one ticket in relation to the religious assembly up in Nichols Oval. So back to your question. So we always prepare for long weekends. We do have sufficient staff working that will be looking for specific infractions. Always those ones that are most common, which is speeding, looking for impaired operation, and just generally safety on the highways, the city streets, in all the jurisdictions that we cover. So it's really just a matter of having that extra eye out there that will have to watch things and deal with what comes as it will.
And this is another long weekend with COVID measures in place. So what will police be keeping an eye out for specifically when it comes to, you know, COVID infractions and regulations and things like that?
So essentially in relation to the, you know, the newest legislation and guidelines that were just released, we'll definitely tailor those observations to that. And very specifically, just looking for the 2 meter distancing and the mask wearing where it's required, but mainly focusing on, excuse me, the existing legislation as it ties into any of the changes that have happened.
Okay, thank you very much, Inspector.
You're welcome. Thank you.
Okay, great. Thank you, Katrina and Jessica from Global News. Okay, so unless I hear from our other callers on the line, if they have questions for our speakers, I believe that wraps it up. So I would like to thank you all for joining us, and please have a safe long weekend. Don't forget the other public health advice about wearing sunscreen and avoiding bug bites and that kind of thing, so that we all stay safe this weekend, and do take care. Thank you again. We'll see you back here on Tuesday. Bye-bye now.
Thank you, Brittany. Have a good long weekend.